Hello, everyone, and welcome to the live session. I will be taking a few questions from you in case you have questions. And before we start, I would like to discuss our camp details. Tomorrow, I'm available in Thane, and this weekend, we are having our camp in Pune. We are in Pune from 24th to 26th of November. So people who are looking to see us in Pune can book up our appointments. Yeah, it's been a long time. We've not done this live session, and this is the number for our appointments: 800-673-8000. Okay, I'm putting this number and I'm pinning this comment so that it is available for you. Everyone can check that. Once again, this weekend, that is Friday, Saturday, Sunday, 23rd to 26th of November, 24th to 26th of November, we are in Pune at Kapila Business Hotel. And if you're looking to see me in Pune, you can join me there. I hope I'm audible to all of you. And tomorrow we are available in Thane at our Thane clinic, Hiranandani Estate, Godbandar Road. A lot of people are not aware that I'm based in Thane and we have this clinic on a regular basis. That is Monday, Wednesday, Friday. We are available in Thane. So, what do you want me to talk about today, or what sort of questions you have? You can put in your questions. Maybe before that, I would like to discuss something, something very important, like. Last week was Diwali, so we had there was a lot of holidays, of course. Couldn't see many patients actually. But yes, we had a few patients from different countries who were visiting India, and they made it a point to see us also. Um, Basically, I am having a few questions, yeah, but I will take all these questions for you. Yes, certainly. So I had a few people who were visiting all the way from different countries, and they wanted to do a session with us. And It was strange to see that there are a lot of people who are not aware of some major ailments. And while we were assessing this, while we were checking that out, we realized that one of our patients actually, she was a teenager and she actually had a scoliosis. So this back pain which sometimes happens in teenagers is basically because of bad posture. But if that bad posture is sustained for a very long time, it can result into mild scoliosis. So scoliosis is of two different types. It is either structural, or it can become bad because of bad postures. And typically this will be seen in teenagers. You will find this more with teenagers also. So this was the situation. The girl was about 13, 14 years old, from Canada. And when I assessed her and I asked their family if they have actually done any sort of investigation, I realized that they were not aware that she's actually suffering from scoliosis. And basically scoliosis happens to be the cause of this back pain. So don't take your back pain so lightly. Don't feel that it's just there and probably is nothing much to do. If there is no clarity about the assessment or diagnosis, you should get into it and understand what exactly could be the cause. And once you understand the cause, you can be in a position to treat it, or do whatever relevant exercises are required, or any sort of changes are required in terms of your lifestyle and diet, in order to ensure that you are pain free. So I have a question from Birva. I don't know what from which place he is. Birva is asking me, which degree do you have? Which degree have you completed in which country? I'm based in India. I'm a physiotherapist and I have specialized in spinal manipulations. I have completed my physiotherapy. I have an experience of 23 years wherein I have completed my physiotherapy. And spinal manipulation is something that I have done from OMT, as well as which is a manual institute from London. And I have done a special basic and advanced course in spinal manipulation. Followed by that, I have also done a degree in chiropractic, which is from the Ackerman College. It's a very known college from Europe, and it is known for a chiropractic practice. And I have done that from there. So I hope that solves your purpose and answer, Birva. Earth Whisperer is asking me, do you have a remedy for flat foot people? Remedy will depend on your complaints. Normally, flat foot people, if they're taking care of their overall, uh, the way they walk, the kind of footwear they use, if they're taking care of that, normally there's no complaint. But if your flat foot starts becoming really bad and your bad walking stance or your standing stance doesn't change, that's where it can start irritating on your foot. Your plantar fascia can get tight. You can also have back pain, or you can also have a lot of hip issues or pelvic imbalances. Treating the flat foot, can first thing that we do normally is checking the footwear and trying to improvise on your footwear. I normally recommend a lot of patients to undergo or take up a proper footwear technique, whether it is an insole or using good shoes. Like Asics are one of the shoes that I normally recommend a lot of people, because it has shown good results with flat foot people. It gives a kind of good support when it comes to flat foot. Besides that, having an insole in your normal footwear is also it's also helpful. You should also be looking at doing a lot of stretching sessions where you can stretch your plantar fascia and also activate your overall foot movements, which can help you probably to improvise on your standing. It can also help you to improvise on your mobility, whether you're walking, jumping, whatever, all kind of activities. So yes, all these things is possible, and you could do this. So yes, it's definitely related to your complaints versus therapy. And whether, even if you have a flat foot and if you don't have any complaints, it's absolutely okay. You don't really need to do this kind of session. HK Sangvi is asking me, is the session required only when there is an ailment, or it can just be a routine check? It can be a routine check, because normally 90 to 95% of people, even in routine check, do have mobility issues, do have pelvic imbalances, do have gait issues. And these things, as long as it is not pointed out to you, as long as it is not explained to you, you don't understand really what exactly is going wrong. So yes, it can be done on a routine check also. And more than everything else, it also gives you a feeling of relaxation, lightness throughout your body, as well as there is a improved mobility for all your joints, whether it is your neck, back. There are a lot of people who come and tell me that, I found that my neck is only moving to this extent, and I took it that way. I mean, I felt that this is how my neck is moving, and I was okay with that, till we came to you and we realized that the neck movements can get better because it has just opened up. So the problem is that we ourselves restrict our mobility to a great extent, because of lack of mobility, because of lack of exercise, all these things. And when you undergo a session like this, yes, it makes a lot of difference. Okay, so Irfan Sky Motors, you're from Goa. Hi Irfan Sky. um, in case we have brittle bones, can this treatment be done? Brittle bones, you mean osteoporosis? Normally, in case of osteoporosis, there are different variations in osteoporosis, whether it is osteopenia or osteoporosis directly. It also depends on that. But in case of severe osteoporosis, we don't recommend this therapy. Normally, severe osteoporosis can be seen either in young people also, who have undergone some sort of huge hospitalization, or probably there has been an intake of steroids. But it can also be seen, it is also normally seen with elderly people, which is like probably 60 plus, 70 plus, depending upon their bone formation. So normally we do not recommend this when it comes to severe osteoporosis. So I would not recommend this. Right. So Barefoot South Indian. Hi dog, you have treated me once in Bombay. Any chances of visiting Gurgaon, or if you can recommend anyone? Uh, yes, Birwa. Thank you so much. He's also in third year of physiotherapy. Okay. Yes, Barefoot South Indian. Any chances of visiting Gurgaon? No plans as of now. You can DM to my team. They will connect you to a good physio in Gurgaon who does this kind of therapy also, and it can help you out. Definitely, we'll do that. Make up your mood. Make up your mood is asking me, any treatment for autoimmune disorder, joint pain and stiffness? Autoimmune disorder is the cause. Now, whether it is rheumatoid arthritis, ankylosing spondylitis, or any other issues, that is a cause. But ultimately, what are the symptoms or what are the issues that are restricting your daily activity? Now, daily activity would be restricted by certain amount of movements. Like in ankylosing spondylitis, your forward bending or probably your rotation can be very difficult. In rheumatoid arthritis, your small joint movements can be a little difficult. Now, depending upon the severity, these sessions can be done in order to kind of improvise your mobility to some extent. In case of severe rheumatoid arthritis or severe ankylosing spondylitis, I don't recommend this session. But yes, if you are in the stage where the whether autoimmune is just a cause, but let's say if your severity is not to that great extent, so yes, in that case, this kind of mobility session can definitely help. This kind of spinal manipulation session can definitely help. Shubhayu is asking me, I had an arthroscopic surgery 2 years ago in my right shoulder. Okay, before I put this question, I want to know one thing. How frequently you want me to come live? Okay, how frequently you want me to have these live sessions where we can actually interact and just have questions. Put in a comment so that I can understand how frequently you want me to be live. Okay. Shubhayu has a question. I had arthroscopic surgery 2 years ago in my right shoulder. There's a minor issue in reaching, still in my shoulder rotator. I feel pain during throwing ball. Is it recoverable and normal? Well, if your surgery is done already and if your movements are fine, all you're lacking is probably strength. If you have not done physiotherapy post surgery, I think you should strongly do the physiotherapy part of it. We can check for tightness in your shoulder muscles. If there are any tightness, that needs to be further reduced. And then the second step is going through a strengthening process, which requires a proper shoulder rehab. See, normally a lot of time people feel that surgery is the only solution to any problem. That's not really the case. Surgery has to be followed by physiotherapy. There are some good surgeons who always recommend you to follow physiotherapy post surgery, but there are some surgeons who feel physiotherapy is not relevant. But then the results are clearly experienced by people. The results are clearly experienced by the patients, where they see that post surgery their expectations are not lived up to. Okay, so they feel that whatever we had done before the surgery, more or less the pain as well as the tightness is still the same. We don't see a lot of change. The problem there is because it is not followed with physiotherapy. So I strongly recommend that whenever you undergo a corrective surgery, whether it is a knee arthroscopy, shoulder arthroscopy, or even huge surgeries like knee or hip replacements, physiotherapy has to be followed till you reach a good range of motion, till you feel that your range of motion is good enough and your surgeon is absolutely satisfied with this kind of with the kind of range that you have. So don't go for a limited range of motion in spite of doing surgery. It doesn't make sense. I mean, you went for a solution wherein you could do surgery and you could do a lot of mobility, and now after doing the surgery for some reason you're not doing physiotherapy and your movements get limited within the first 3 months itself. Doing any sort of physiotherapy after 3 months or 6 months is very difficult because the muscles have already gained that sort of length, and it's very difficult to kind of improve onto that range of motion. Earth Whisperer says, thank you so much. I came to you twice and both sessions were life changing for me personally. I'll get my daughter to her session. Thank you so much, Earth Whisperer, for your chat here, and thank you for all your comments. Thank you so much. Make up your mood. Make up your mood is saying, I have a pain behind knee area, but on one side. As rheumatologist, it's swelling. Is there any treatment for so? Any treatment for autoimmune disorder? Like, yeah, you already asked that. We'll have to understand exactly what it is. I mean, it could be rheumatology also. It could also be some ligament issues, or it could be probably a muscle stiffness. So we need to check into that and understand, because not a lot of times in case of rheumatoid patients, it's not important that every time whenever you have a joint pain it is because of rheumatism. It can also happen because of because if there are if you have done anything which has probably created some sort of extra stress to the joint, or if you have had a injury, or if you had any forced movement because of which the pain has come back. So there can be multiple reasons. We cannot every time focus and say that, oh, because you're a rheumatoid patient you will have pain throughout your body and throughout your life. That's not the case. Yes, we can look into that. Make up your mood. Yeah. Okay, Misha Vanshi has a question. I had developed lower back pain post pregnancy. It's become worst over the last 16 years. In my recent checkup, I was diagnosed with spinal imbalance and posture problems. Can I be given this treatment? Yes, you can be given this treatment. It's a very common issue. A lot of people face back problem post pregnancy, and within a year or two, it's important that you get back to your fitness, lose out that extra weight that you've been gaining post pregnancy, and try to live a more mobile life. Okay, what happens is that we actually just take that pain and live with it and feel that okay, it has happened after surgery, it has happened after pregnancy, or it has happened post because of some anesthesia issues, and then you just live with that pain. It is very much possible for you to reduce that sort of pain with proper mobility, and spinal manipulation can definitely help. Yes. Harsh Khopade is asking me, when are you available in car? I think next car we are on 2nd of December. We'll be there on 2nd of December. Yes, HK Sangvi, yes, we'll be in western suburbs very soon. Yes, that also reminds me of announcement that we are planning to come up in Lower Parel recent very soon. So for all the South Bombay patients, we'll be in Lower Parel. Definitely not on a Saturday, Sunday, but maybe one of the other days. Yeah. All right, thank you so much. Viral Parekh, manipulation help with knee issues. Yes, manipulation can help with knee issues depending upon the age factor. It doesn't help in severe osteoarthritis. It can help in some sports injuries. It can also help in patellar issues because a lot of time your patella tends to be tight and it's actually shifting onto the outer side of the knee. Okay, normally it has to be in the inner side of the knee, but it starts shifting to the outer side, and that's where knee manipulation along with taping can help. Along with this, you also need to understand that how is your mobility in terms of standing, walking, and all of that. If you have a knock knee, or if you have a let's say a bow leg, so in both these cases there can be issues because of knee pain, so that needs to be sorted. Viral Parekh, I know therapy can help with back and neck. Knee problems for my mom. Yeah, I mean, see, if like I told you, if it is severe osteoarthritis, you should not be expecting too much of results. But yes, if it is a mild one, you can expect results. Thank you everyone. Thank you Sabri, Srinath. Good information. All right. TMJ treatment. TMJ treatment. Again, we need to understand the diagnosis. A lot of people do not have diagnosis, but they still feel that they don't have any diagnosis with them, but just because there is pain, so they feel if there is a treatment available. First, it is important, where is this pain coming from? Is this coming from a joint? Is this coming from the disc area? What exactly is the difficulty? Definitely spinal manipulation helps here, because we have been working with a lot of TMJ specialists, and spinal manipulation is a very crucial aspect of this therapy, because after spinal manipulation, the TMJ specialists have seen a tremendous amount of change in the TMJ movements, as well as it is neck to neck calling me. They are giving me video calls now because I'm live, so I'll not be picking up any calls right now. Since I'm live, we can connect later, so please don't call at this point of time. So yeah, I was talking about TMJ. So yes, since it is connected with the neck, there are chances that it can definitely get better. तौफिक वॉली हैज़ अ क्वेश्चन. आई एम अ वॉलीबॉल प्लेयर. राइट शोल्डर बहुत पेन होता है फर्स्ट बॉल स्मैश करने के बाद. थोड़ा स्ट्रेंथनिंग करो तौफिक. फंक्शनल इम्प्रूवमेंट, फंक्शनल ट्रेनिंग होनी चाहिए आपकी. अगर आपकी एक्टिविटी वॉलीबॉल प्लेयर की है, तो थोड़ा सा फंक्शनल ट्रेनिंग करो. नॉर्मली हम सिर्फ वेट उठाते हैं. वेट उठाने से अच्छा है कि आप थेराबैंड यूज़ करो, और उसी एक्शन में थेराबैंड स्ट्रेंथनिंग करो जिस एक्शन में आपकी वॉलीबॉल की शोल्डर मूवमेंट्स होती है. बिकॉज अदरवाइज बॉडी सरप्राइज हो जाती है, बॉडी शॉक में आ जाती है. अगर आपके शोल्डर में थोड़ी भी वीकनेस है, उसके वजह से आपको वो पेन हो सकता है. सो स्टार्ट फंक्शनल स्ट्रेंथनिंग. ओके. हेलो विठल कामले, कैसे हैं? Yes, so thank you so much. We have a lot of people joining in, and Shantanu Joshi has a question. What is the difference between chiropractor and physiotherapist? Physiotherapist is a physiotherapist. Chiropractor works more with spinal manipulation. I am a physiotherapist and I have specialized in spinal manipulation, and I'm also enrolled and have finished my chiropractic practice, which is a different degree altogether. So physiotherapy is a very different area of work, which is equally important and relevant for your injuries. And I normally recommend a lot of my patients to undergo a lot of exercise, because just by doing spinal manipulation the results don't come. So for me, my therapy is more holistic. It is a combination of chiropractic as well as physiotherapy. Okay. From where can we learn this kind of therapy? From where can you learn? Well, in India, there is no specific college as such teaches you which teaches you chiropractic course as such. But also you have to have a medical background. So if you are a physiotherapist, there are some institutes which are associated, and they are working, and they are organizing workshops for basic and advanced courses, and you can try and attend that. आकाश, मैं बहुत जल्दी थक जाता हूँ. प्रॉपरली खाओ और अच्छे से नींद नींद करो, जल्दी थकना कम हो जाएगा. Getting stiffness on both ankle. Okay, so I think I have answered a lot of questions. So thank you so much, guys. It was an amazing session, and I think I answered to a lot of questions. And I hope you could get a clarity about your problems. Once again, this weekend, that is 24th to 26th of November, we are in Pune. So if you want to see me in Pune, if you want to make up an appointment in Pune, the number is 800-6738-000. I have already marked the number. I have already pinned the number on the comment section, so it will be on the top of this, and you can connect with my team for an appointment. And tomorrow I'm available in Thane, so with the same number you can connect us for appointments in Thane also. And next week I'll be in Bandra. That is 2nd of December. So looking forward to see you all, and do comment about how frequently you want to see me live. Thank you. Thank you so much.